I'm Fraser Fellows. I'm an obstetrician gynecologist who does abortions, and I'm going to defend that position and suggest that abortions are necessary and part of the mandate of a gynecologist in worldwide to carry out. To me, a person is the woman who is sitting in front of me in my office. This person presents to me with a situation, and I, as a professional person, am obliged to treat her without any bias, regardless of my personal beliefs. The majority of Canadians agree with a woman's right to choose. The last time it was officially assessed, that is, evaluated in the Canadian population, approximately 75% of Canadians agreed that a woman had a right to choose. Aside from the obvious reason for disagreement, that is the right of a woman to determine her reproductive choice, whether she wants to be pregnant or not, there are several other factors which control this opinion by Canadians that a woman has a right to choose. And I would address these three issues in my defense of performing abortions. I'll talk about it worldwide, I'll talk about it in a particular country, and I'll talk about it here in Ontario. The provision of abortion services obviously is always going to be a polarizing topic. There always will be people who are against abortion and people who are pro-abortion. I can tell you as an abortion provider that doing an abortion is not something that I take great pleasure in. However, helping a woman solve the conundrum that she is presented with is something that I take pride in. If you look at the abortion rate worldwide in 2003, and this was information that was gleaned by the Guttmacher Institute, and that's the last year that I'm aware that the statistics are available. There were 42 million abortions that year out of 205 million total pregnancies. This rate is declining. Of those 42 million abortions, 21 million were in countries where abortion is legal, 21 million were in countries where abortion is illegal. The main difference in those countries where it was legal versus illegal was in the countries that it was illegal or banned by the governments or not supported financially by governments, was that the maternal mortality rate and morbidity rate was 30 to 40 times higher than in the countries where it was legal. In other words, women would get an abortion in countries where it was illegal, but the abortion would be provided by anybody who said that they could do an abortion. It wasn't provided by professional people. And as a result of this, criminal abortions, as they are called, would cause injury and death. It causes, in 2003, it caused 5 million women to be hospitalized, treated for complications related to unsafe abortion. And in those women, of course, were identified the various methods that they would use or were used on them to end the pregnancy. This is how desperate they were. They would do turpentine, they would stick slippery elm in the vagina, they would put potassium permanganate in the vagina, and these, of course, would either maim or kill the woman, resulting in 13% of total deaths worldwide in that year, or 67,000 women dying from abortions in that year. The other problem with a lack of successful abortion programs is that worldwide, 22,000 children would lose their mothers and be parentless, or at least motherless, for the rest of their lives. As far as countries, Romania conducted the one of the most interesting experiments, if you like, for lack of a better word, in preventing women from accessing abortion services. Between 1980 and 1989, the husband and wife team, known as the Chechescu's, were decreed that there would be no contraception and no abortion in that country. And they actually took steps to enforce this decree, including pelvic examinations, testing in the workplace, and basically scrutinizing the behaviors of people throughout the country during that 10-year interval. During that 10-year interval, what happened was that women were therefore forced to go underground and access criminal abortions. This criminal abortion activity resulted in a maternal mortality rate. If you look at this slide, which shows the maternal mortality rate per 100,000 live births in most of Europe, Eastern Europe, you can see that Romania, during that 10-year interval, had more than a 30-fold increase in the incidence of maternal mortality. And this was related to death from criminal abortion. The other thing that happened was that the phenomenon of Romanian street children also occurred, and these were women who could not access abortion and who were forced to carry on with the pregnancy, but in the end, after the child was born, they gave the children up to society, either officially or unofficially, resulting in, again, as I said, the Romanian street children. In 1969, where most of you are probably aware of Roe v. Wade, and in that instance, in the United States of America, abortion became legal. In other words, a woman in the United States for the first time had a right to have an abortion. In most states, some states still prevented it from happening. If you look at the maternal mortality rate, and these are maternal deaths in Ontario in 1933, you can see that there were a large number of abortion deaths, either from sepsis or from hemorrhage. And in fact, of that 334 maternal deaths in 1933, about half of those were deaths from criminal abortions right here in Ontario. This death rate from criminal abortions in Ontario continued until 1969. When I was a resident, I began my residency in London in 1966, and as a resident in the emergency departments in London, we would see women coming in with morbidity and mortality related to criminal abortions, either self-induced or criminally performed by lay people or physicians who were not skilled in doing abortion. And this resulted in women dying from these illegal acts. After 1969, when the states condoned abortions or allowed abortions, the same thing happened in Ontario, and it became a right of a woman to seek an abortion, albeit with some constraints. And it wasn't until 1989, approximately, when abortion was decriminalized, that it became any woman could choose to have an abortion if she wanted, without any restrictions as far as hospital boards or hospital committees deciding her fate. As a result of that, you can see that if you look at the maternal mortality rate and the column on the far right, the maternal mortality rate was 4.7 per 100,000 live births in 1991, compared to 334 deaths in 1933 per 100,000 live births. So there's a huge reduction in maternal mortality rate in Ontario over the intervening 20-some odd years, related to the ability to access abortion services. I can show you some of the cases, but I'm not going to discuss that right now. My time is running out. But I will just summarize the fact that women will achieve an abortion whether it is condoned or not. The worldwide statistics support the idea that, as I said, in countries where it's available, the rate is essentially the same as it is when it's not available or legal. The big difference is that women die because they seek non-professional alternatives to achieve their desired abortion. Countries have tried to eliminate abortion by making laws and having police do surveillance, Romania being the example that I gave, and this did not work. It resulted in more women dying, more women being injured, and more children being abandoned as street children. Finally, in our own province of Ontario, we have seen over the past 30 years, as a result of Roe v. Wade and then decriminalization of abortion, a significant reduction in maternal deaths related to being pregnant, and more specifically, a complete elimination of women dying or being injured from criminal abortions.